These days, it can be hard to trust the media. What's true, what's fake, and who is behind the message? I'm a freelance journalist and videographer who has spent years studying the media. Now I'm taking a look at what local, regional, and national news stories mean to us here in North Central Washington. I'm Dominick Bonny, and this is Common Sense. Hello and welcome to another episode of Common Sense. I'm Dominick Bonny, and as you may have already noticed, I'm not in the studio. I'm in my office in front of my bookcase here. But that's okay. COVID-19 has disrupted all our lives, and the topic of today's episode is actually COVID-19. My first interview, I'm going to speak with a woman named Carrie DeMarco. She's a local woman and a realtor, as well as a teacher and a mother. But most importantly right now for her, she's living through stage 4 cancer. So I'm going to talk to her about what our decisions when it comes to public health mean for somebody who's in a vulnerable position like herself. Later in this episode, we're going to talk to Dr. Tyler Fishback with Confluence Health. He's the pharmacy manager at Confluence Health, and he's been put in charge of COVID-19 vaccine distribution in our region. They're both informative and interesting interviews, in my opinion, so I hope you'll stick around. Let's talk to Carrie.
So I had cancer in 2007, but it was just 2A. So I did what they said, including surgeries and chemo and radiation, and was fine. But this summer, end of June, beginning of July, I found out I had metastatic breast cancer, already stage 4. I'd been doing mammograms, but the kind I had, inflammatory breast cancer, doesn't get caught very often on a mammogram. So it had already spread by the time we had it. And so then I started chemo in July and have been doing 3 Fridays a month since July, and I'm almost done with 6 months of chemo. And I have done a radiation twice for areas that are extremely painful. I even broke some ribs. So when you have metastases to your bones, they get real brittle. So just some dogs greeting me, overly friendly, broke at least 2 bones, and so I got radiation for that and the pain for that recently.
Wow.
Yeah, and starting in January, I can take a pill called Ibrance, hopefully, instead of chemo, so that'll be better.
Oh, well, that's good news.
Yeah.
So what's it like living with cancer through times like these?
Yeah, I mean, in some ways, you're like, oh, my immune system's down, so it's nice everybody cares about not spreading colds, etc. But COVID is a lot worse than a cold or flu. And so I guess what I think of is when statistically speaking with my cancer exact type, they think that I would have 2 to 5 or more years left to live if I take the treatment. Of course, a lot less if I didn't do the treatment, but I'm taking the treatment. So 2 to 5 years is statistically speaking or more if it all goes well with the treatment. But the thing that happens during COVID is if I was to catch COVID, I could be dead in 2 weeks. Mm-hmm. So that's what COVID does when you have stage 4 cancer.
Yeah.
It could take those last years that I've got a 6 and a 14-year-old. I've got my biological kids are 27 and 25. And we have a daughter that's not legally our daughter, but we think of her as, that's 22. But I've got adopted kids living at home that are 14 and 6. And my determination is to live for them as long as I can, those 2 to 5 or more years. So I'm really, really concerned about COVID because they've already lost their biological mom. They're a couple foster moms. They don't need to lose me at all, but that's going to happen earlier than it should. But literally with COVID could be a bad 2 weeks and gone. And so that's what's scary to me.
Yeah, no doubt. So I mean, for you, other people's decisions about how they act during a pandemic could have real repercussions that a lot of us don't maybe have to even think about. So how do other people's decisions have the ability to impact you or your family?
Yeah, so I was a teacher for 28 years. So I chose to quit teaching so that I wouldn't have to, well, for one, treatment itself is hard. But also with COVID going around, it's not worth the risk. So I had to quit my job. Luckily, I was able to go on medical disability. And I have my two kids that are in school, kindergarten and ninth grade. I have them doing WIA, which Wenatchee Internet Academy, so that we can keep them home and not have them leaving the house at all. So very thankful for that option. And other than that, I try and stay home as much as I can. I've tightened up in this recent, as COVID has exploded some more. I've tightened up the parts that weren't as tight as maybe they should have been before, like seeing my friends that tell me they're social distancing. Now I don't even see my friends. We canceled our Thanksgiving plans with family out of town. Like it's tight, but I can be Fort Knox tight with my personal life, and of course that's on me. But I have to go to chemo 3 times a month. I have to go to radiation whenever they tell me. I have PT scans, MRI, bone scans, pharmacy visits to go pick up my medicines. And each of those times I'm in the public, because I have to be, I'm reliant on those people to have lived their personal lives in such a way that hopefully they have been social distancing and masking, so that I'm not around people in the moment that might have it unbeknownst to them, since you've got 5 days where you're asymptomatic. And so they might think, oh, it's no big deal, so I'm fine, but they might actually be carriers and not know it. And then I was recently standing in line to pick up my medication at the pharmacy, and the man in front of me was not wearing a mask. And it's a tough thing. Do I speak up? Do I not? So I thought I'll be polite and assertive. And I said, sir, if you forgot your mask, they do sell them here. And he was extremely angry and misinformed, and telling me that since I was wearing a mask, there's no way he could give me COVID, which is not what the scientists are saying. And hopefully he doesn't have COVID and it's all moot, but he doesn't know that. I don't know that. And I was trying to explain that he's at least half of the equation of whether, pretend he accidentally had COVID and didn't know it, he's at least 50% of the equation of whether, my mask is less than 50% from my understanding, and his mask is at least 50%. If he accidentally had it, he could transfer it to me. And I could be gone in 2 weeks, and he goes about his business not knowing he had any impact. So that's what I just really, just for me, clearly I represent a lot of people who have comorbidities, and we're relying on other people to do their part as well to follow what scientists are telling us will keep everyone safe. So I just plead with people. That's all I can do.
Yeah. So what's your reaction when you see people planning public events in defiance of state and local public health guidelines? Like, I know that there's been a few, and I don't want to necessarily go into just reporting on who's planning what, because that's not really the point, I don't think. But when you see stuff like that, how does that make you feel?
Again, people a lot of times say, well, it's my body. I can choose to wear a mask, or I can choose to socially distance or not. It affects me. But somebody gave me the analogy that I thought was pretty appropriate. That's like saying I can drink and drive if I want. Well, I guess if you're the only one that is injured by your drinking and driving, I guess you can do that if you want. You can take that risk if you want. But as we know with drinking and driving, it's often other people injured as well, if not oftentimes worse. Yeah. And so I would say COVID is the same way. So when somebody, I have freedoms to do this, that, and the other, and let me live my life, and let me have Christmas joy, and let me this and let me that, I think I'd prefer they not do any big group events. But if they do, certainly have social distancing, 6 feet apart at all times. And if there's a public area you're in, such as using a restroom with somebody else, that you're wearing a mask, that you're staying 6 feet apart as much as possible. And those are the things that when I hear there's going to be a big gathering, I think, oh no, we're already overrun. Our hospital is already overrun. And my daughter my 14-year-old just got her appendix out the other day. So when I heard Dr. Rutherford saying, even an appendix, you could be backlisted compared to a COVID patient, I thought, well, I guess it's good her emergency happened a week or two ago instead of a week or two from now. I just plead with people to make short-term, give something up in the short term. We're almost there, so that we're not overrunning the hospitals for people who need them.
Yeah, absolutely. Well, is there anything else that, you want the public to know just about your story, or I guess, your experience with public health at all? That's usually my last question.
I'll just add my own run-ins with COVID. Luckily, my children and husband and I have been COVID-free. We've been very safe, but also there's a portion, that's where you can also say luckily. But my mom had to get hip replacement surgery in Spokane. And unfortunately, her surgeon at that hospital didn't believe in testing for COVID before surgery. And therefore, we're assuming that's where, because she doesn't leave her house much, she's been cautious, that's where she caught COVID. And she didn't know she had it. So she's in her own home. Her boyfriend of 3 years, Ron, who I looked at as my stepdad, and my aunt, my mom's sister, and my two sisters-in-law, they took turns coming to take care of somebody who can't even hardly walk from hip surgery, giving her food and making sure she had her medicines and stuff. Well, guess what? They all caught COVID because, they didn't know she had it, because you have, I think it's 5 days asymptomatically. Well, yes, they all recovered except for my mom's boyfriend, Ron, who died 10 days after symptoms and was pulling out the oxygen tubes because they were that uncomfortable, and they were trying to medicate him and beg him to leave him in, but evidently that's how bad it is. So when people say, I'm sorry, I get a little upset when people say, it's uncomfortable for me wearing a mask. And like, level of discomfort where you'd rather die, where you do die. There's levels of discomfort.
I think sometimes we think, well, what's the problem with not wearing a mask or not socially distancing? It's my decision. It could impact my health. If I get COVID, I'll probably live. But the fact is that so often, more often than not, I think those decisions can impact other people in ways that we don't even understand. They could even lead to other people's death. And Carrie is one of those people. If she, because she has to go to the pharmacy, because she has to go to the doctor, those are places where she's exposed and she's putting herself at risk. And I think it's important to remember what she said at the end of the interview there, where we don't know where other people are coming from. We don't know if they have a pre-existing condition. We don't know if they have cancer. So if somebody asks you to put on your mask at a public space, think about that. They might have cancer. They might have a pre-existing condition. They might be vulnerable in ways that we don't really understand. So rather than reacting with anger, I think we need to have compassion and empathy with others now more than ever. Stay tuned after the break, because we're going to talk to Dr. Tyler Fishback with Confluence Health about the COVID-19 vaccine, when it will be here, when normal folks, average folks can expect to receive it, and fight back, debunk some of the misinformation that is, rampant with throughout this entire ordeal of our global pandemic. So stay tuned, and we'll see you after the break.
Choose the pros. Alignment Pros. When your vehicle needs brakes, shocks, struts, or alignment, choose the experts in their field. Alignment Pros and Express Lube with a 5-star rating. The work they perform on your vehicle is as impeccable as their shop. With state-of-the-art equipment, Alignment Pros can handle all large or small vehicles, specialty cars, lifted or lowered. Alignment Pros does them all. Keep your car in top shape at Alignment Pros and Express Lube in East Wenatchee.
when will the vaccine be here in North Central Washington, and how is that going to look like?
Yeah, the vaccine is going to be here December 15th is the date that we're expecting, sometime next week. And it's going to arrive directly from the manufacturer, which we're anticipating Pfizer will be the manufacturer that's authorized first for use in the United States. It's already been authorized in 2 other countries, I believe. And it will arrive in a thermal shipping container that has 975 doses. It's one that has very specific storage and handling requirements. And so it's at -70 degrees. So the shipping container will have dry ice and a temperature tracking device in it to make sure that the integrity of the product is maintained.
How will it be administered, and will that be in phases?
Yeah. Well, there's a lot of different groups discussing how the vaccine should be utilized. And I would say that some of the key terms would be that we want to maximize the benefit, especially when the supply is limited. Some of the focuses right now are acute care facilities that are incredibly resource strapped as they try to take care of more acutely ill patients than ever before. And so healthcare workers have been prioritized. And when I say healthcare worker, that's not just the nurses or doctors that are directly caring for patients, but also the EVS staff that's cleaning these rooms where COVID patients have been taken care of, people that deliver trays, the lab staff that carry samples, also the people at our drive-through testing centers that are swabbing people that have COVID or potentially have COVID. All those are people that qualify. In fact, most of the workers in our organization would qualify that have any proximity to the caring for these patients.
How soon can we expect more doses after that first batch?
Yeah, that's a really great question, and more information is really coming to light every single day. We do have a sense that more vaccine from Pfizer would be right on the heels. So I submitted a survey yesterday to the Department of Health that was already inquiring how much more vaccine would we be ready to receive and vaccinate with as early as early part of the week of Christmas, around the 21st, 22nd, and we might receive another 1,000 to 3,000 doses in that week. And so that's what we're expecting. But as we look forward, there is another vaccine that's right on the heels. It's a second mRNA type vaccine produced by Moderna. And the FDA is meeting December 17th to decide whether they will issue an emergency use authorization for that product. And so after that is approved for use, then we might shortly after be seeing a second vaccine that becomes available. Don't have a great sense yet of just how much availability there will be with that second one, but that's coming as well.
How do they combat COVID-19?
From the standpoint of someone that has loved biology and biochemistry, they're really pretty fascinating just where we've gotten with our technologies. But essentially, this is a small strand of RNA, which is similar to DNA, but it's a single strand. And, the central dogma, as they call it in biology, is that all of life, whether human or insect or a tree, we all share this common language, which is DNA. And DNA codes for proteins. And so this small strip of RNA that is injected into the body is taken up by cells. And our own cells machinery constructs a protein that is similar or identical to a part of the coronavirus, the spike protein. And then the body does what it does and knows how to do best, which is recognizing this protein as being foreign. It's never seen it before, and it mounts an appropriate immune response that renders us to have, to be immunized against this virus in the future. And so they're seeing that even as early as 10 days after the first vaccine, and it's a 2-dose series, you would have at least partial immunity. And after the second dose, a very effective immunity to this virus, which is very promising.
People who receive this vaccine, can they expect to basically go back to life as normal? I mean, maskless, hugging.
What we know is that vaccines are an incredibly important part of getting back to some semblance of normalcy. But there are other layers that are still important in this process, especially as we work to get, this term of herd immunity. We need to get a vast majority of people with some form of immunity, whether that's from an actual infection or from the vaccine, to really be protecting one another effectively. The important defense mechanism, the social distancing things, staying home when you're ill, and quarantining, the testing that we're doing to identify who has active infection, all those things are still going to be a part of this response.
People are saying this is a way for Bill Gates to control your minds, or turn you into a 5G antenna, or sterilize you. There's so much misinformation. How can we debunk misinformation like that, and where can we get the best quality information?
There's a bit of a crisis in terms of how we receive our information, and we have to be careful because the perception is reality, and we're perceiving what reality is sometimes based on information that just is not very high quality. I will tell you, the more that I've researched this vaccine, I'm just really in awe of just the amount of integrity and rigor that's put into the scientific process to make sure, with the sole focus of this being a safe and effective vaccine. And I encourage just using the information that CDC is putting out, as well as the State Department of Health, and information is cascading through our organizations and through our region, through our local health jurisdiction. That's the high quality information, and we want to turn to that as a consistent source, so that we're all kind of talking the same language, understand the risks, because it is important to understand the risks. We need to talk about the real risks, not kind of conspiracy theory risks. Those don't help the conversation.
If there's anything else that you'd like to say about this issue?
It's a marathon, not a sprint, as they say, although there's a ton of urgency right now because of the rising cases of COVID-19. This is an endeavor that's going to go on for months and months on end. And so, we need the kind of stamina and endurance to see this thing out. We know that some people are ready for a vaccine. Others maybe want to watch the first wave, put out their arm first and see what happens, and then kind of let that early adopter phase go and be part of the next wave. And I think, that's fine. Everybody's at a different place on that continuum, and we appreciate that. And we want to get those people good information, give them the time they need to have all the information they need to make a good decision.
It makes me feel happy.
I feel proud.
Gratitude.
Connected.
It really fills me up with happiness.
Honor. Humble.
It makes my heart happy.
Satisfacción. Alegría.
Just happy that I'm able to do such a thing.
I'm just grateful I can give.
So there you have it. Two important interviews, I think, to understand two different perspectives on the COVID-19 pandemic and how it's affecting our community and individuals within our community. There's been a lot of talk lately about public events, concerts, outdoor events, and as well as parties and private parties. And, a lot of condemnation, a lot of judgment going around, especially on social media here locally. And I didn't want to pile on that bandwagon. I'd rather speak with experts as well as people who are living a lived experience that might change people's minds. And if you truly listen to Carrie, as well as Dr. Fishback, but especially Carrie, if you truly listen to what she has to say, I think it might open your mind to different perspectives and to thinking about what other people are might be living through, trying to survive through. I'm very lucky to be relatively healthy and young and active, and so I don't really have to worry too much if I catch COVID. But I have family members. I haven't been able to see my grandparents for months, and they don't want me to come see them because I could be the vector that brings COVID into their lives, and they have pre-existing conditions and they're elderly. But I'd really like to see my grandparents, especially during the holidays, but I won't because it's not responsible. Hopefully soon we'll all be able to take the COVID-19 vaccine. And I think that these rumors and propaganda and misinformation, I call it the infodemic, that surround the COVID-19 vaccine. Bill Gates is trying to control our minds. People are trying to microchip us or sterilize us. These are all things that are associated with almost every vaccine ever. And they're always rooted in paranoia and superstition and never in evidence. So I really want to challenge people to do your own research, but listen to the experts, because these people have nothing to gain. Like, Bill Gates doesn't have anything to gain by trying to stick a microchip in you. He's already like the richest guy in the world. He doesn't care. But people like Dr. Tyler Fishback do care. And people who are working at Confluence Health do care. And they have our best interests at heart. And so when I see the jaded, cynical mistrust of people who have taken the Hippocratic Oath, and people who are saying, even if you go to parties, even if you go to concerts, even if you catch COVID at an event that we told you not to go to, we'll still care for you. That's the professionalism and empathy and care that our medical professionals have. And so it really upsets me, frustrates me to see people treat them like they're trying to put one over on us when really they're just trying to protect and serve us and keep us all healthy. So that's what I want to leave you with today, is just a plea from the heart to listen to the experts. Second guess any mistrust that you might have, and ask why. It's okay to be skeptical. I'm a skeptic. But it's another thing altogether to throw the baby out with the bathwater and mistrust just for mistrusting's sake. I'd also encourage and challenge everybody to reach out to people who might have to be quarantined, like Carrie or like an elderly relative, and see how they're doing. Ask them about their perspectives. Ask if there's anything that you can do for them. Crisis also offers opportunity. And what we choose to do with these opportunities that this pandemic has offered us says a lot about our characters. So be a part of the solution rather than making trouble for others and potentially putting people's lives at risk. Join me next time for another episode of Common Sense.